According to the latest World Health Organization statistics, over 530 million people worldwide have diabetes, with 1 in 6 adults over 30 in Korea living with this condition. But here's the shocking truth: 4 out of 10 diabetic patients experience dangerous blood sugar spikes or life-threatening complications due to incorrect exercise choices. If you have diabetes or have family members with this condition, this video contains potentially life-saving information. By understanding and implementing what you'll learn today, you can not only manage your blood sugar effectively, but also prevent dangerous complications that could change your life forever. When exercise becomes poison for diabetics, leading medical universities have uncovered a terrifying reality. Through large-scale cohort studies, when diabetic patients exercise in a fasted state, instead of lowering blood sugar as expected, their liver converts stored glycogen into glucose, causing blood sugar to spike dangerously. Even more alarming is high-intensity exercise. For type 1 diabetics with elevated blood sugar, intense exercise can worsen glucose control. Without adequate insulin, exercise can increase blood sugar levels and trigger ketoacidosis, a potentially fatal emergency condition. High-intensity workouts activate the autonomic nervous system, releasing stress hormones like cortisol and catecholamines, which naturally elevate blood sugar. This means the very exercise intended to lower glucose can become toxic to your system. Blood sugar thresholds for exercise restrictions are crystal clear. If pre-exercise blood glucose is below 100 mg/dl or above 300 mg/dl, you must stabilize your levels before any physical activity. When fasting blood sugar exceeds 250 mg/dl or you feel fatigued, exercise can burden your body and should be postponed. Dangerous exercises diabetics must absolutely avoid. First and most critical: high-intensity vigorous exercise. When blood sugar is uncontrolled, activities like mountain climbing and competitive swimming can actually elevate glucose levels further. Diabetic patients must avoid all vigorous exercise forms. Second, high-impact foot exercises for neuropathy patients. When diabetic neuropathy reduces foot sensation, intense running can cause wounds you cannot feel, leading to irreversible damage. This silent injury progression can result in devastating complications. Third, exercising muscles where insulin was injected. Patients using insulin must avoid exercising the injection site muscles. Concentrated muscle use accelerates insulin absorption unpredictably, potentially causing dangerous hypoglycemia. Fourth, late evening workouts. To prevent nocturnal hypoglycemia, late evening exercise should be avoided. Exercise's blood sugar lowering effects can persist for over 12 hours, creating dangerous overnight glucose drops during sleep. Fifth, intense exercise with existing complications. Patients with severe diabetic complications, liver disease, or advanced atherosclerosis face serious cardiac and vascular risks from post-meal intense exercise. Essential exercises every diabetic must do. Meta-analyses from prestigious international medical institutions reveal that the most effective approach for diabetic patients combines moderate aerobic exercise with resistance training. Type 2 diabetic patients who consistently perform both aerobic and resistance exercises show improved glucose control with enhanced fitness, leading to even better blood sugar management. First, essential exercise: walking. Light activities like walking, gentle jogging, calisthenics, and cycling provide the safest and most effective foundation. The ideal intensity allows comfortable conversation while working up a light sweat. Second, regular aerobic exercise. Aerobic activities should be performed 3 to 5 times weekly for 30 to 40 minutes post-meal. The American Diabetes Association recommends moderate intensity exercise at 50 to 70% maximum heart rate for at least 150 minutes weekly across 3 or more sessions. Third, strength training. Resistance exercises should be performed 2 to 3 times weekly at 75 to 85% maximum intensity, with 8 to 10 repetitions across 3 sets. Conducted 3 times per week for optimal results. Fourth, safe aquatic exercise. Swimming, water walking, cycling, and upper body exercises at moderate intensity should be performed 5 or more times weekly. Aquatic exercise is particularly ideal for diabetics. as it provides full body muscle engagement without joint stress. The science of exercise timing and blood sugar management. Exercise timing critically impacts glucose management. Patients using oral glucose-lowering medications or insulin should exercise post-meal to prevent hypoglycemia, beginning 30 minutes after meals when blood sugar starts rising, and exercising for 30 to 60 minutes proves most effective. Interestingly, exercise sequence matters significantly. Research with type 1 diabetic patients revealed that performing resistance training before aerobic exercise provides greater blood sugar stability and more effective hypoglycemia prevention compared to the reverse order. The key to intensity control is the talk test. Appropriate exercise intensity allows normal conversation with others. If you cannot maintain conversation during exercise, the intensity is too high and may cause adverse effects rather than benefits. Pre- and post-exercise blood sugar monitoring and safety protocols. Blood glucose testing is absolutely essential for diabetic exercise safety. Pre- and post-exercise glucose monitoring is strongly recommended. If pre-exercise blood sugar falls below 100 mg/dl, appropriate snacks are necessary, specifically 1 cup of milk or half a banana. Exercise's blood sugar lowering effects can persist for over 12 hours, requiring careful glucose observation, both before and several hours after exercise. This monitoring becomes especially critical when starting new exercise programs or changing exercise types. Insulin users require even more meticulous attention. They may need to reduce insulin doses or increase carbohydrate intake. Inject insulin into non-exercising areas, like the abdomen, and avoid exercise when insulin activity peaks. Complication-specific customized exercise strategies. Special guidelines exist for neuropathy patients. Those with diabetic neuropathy and reduced foot sensation must inspect their feet before exercise. Wear thick socks and comfortable athletic shoes. Limit activities to gentle walking or safe cycling, and re-examine their feet post-exercise. Patients with cardiovascular complications require particular attention to cool-down exercises. Diabetics face higher cardiovascular disease risks than the general population, making proper cool-down crucial. Those experiencing post-exercise dizziness or chest pain must emphasize gradual cool-down procedures. Cool-down methodology is specifically defined. Cool-down should last 5 to 10 minutes, focusing not on stretching but on gradually reducing the intensity of the primary exercise. For example, if you were walking briskly, finish by walking slowly. Lifestyle habits that maximize exercise benefits. Exercise effectiveness for diabetics closely relates to daily lifestyle habits. Using pedometers to track activity and walking at least 5,000 steps daily. Taking stairs instead of elevators and walking short distances create significant cumulative benefits. Exercising 10 minutes 3 times daily provides equivalent health benefits to exercising 30 minutes once daily, making it achievable even within busy schedules. Proper pre-exercise hydration is crucial. Dehydration elevates blood sugar and impairs heart function. For hot weather or extended exercise sessions, consume 500 cc of water 2 hours before exercise. Warning signs requiring medical consultation. If any of the following apply, mandatory medical consultation before exercise is required: cardiovascular disease, severe hypertension, or severe microvascular complications, including retinopathy, autonomic neuropathy, or peripheral neuropathy. Patients with coronary artery disease or complications may have exercise therapy restrictions, requiring medical evaluation to determine appropriate exercise protocols based on individual assessment results. Immediately stop exercise and seek emergency care if dangerous symptoms appear. If hypoglycemic symptoms occur during exercise, consume carbohydrates immediately. Seek medical attention for dizziness, chest pain, or severe shortness of breath. Long-term effects of proper diabetic exercise. Long-term follow-up studies of diabetic patients who consistently practice appropriate exercise show remarkable results. Even a modest 5% weight reduction can decrease insulin resistance and lower blood sugar, while providing additional benefits including improved cardiovascular function, reduced cardiovascular risk factors, enhanced strength and work capacity. blood pressure control assistance, improved quality of life and confidence, and reduced psychological stress. Exercise increases muscle mass, improving strength and physical function while enhancing mental health. The incidence of cardiovascular diseases like angina, myocardial infarction, and stroke can be significantly reduced. While diabetes cannot be cured, proper exercise and lifestyle management enable completely normal living. Implementing today's guidelines accurately will facilitate both blood sugar management and complication prevention. However, since appropriate exercise varies by individual condition, consultation with healthcare providers before starting any exercise program is essential to receive personalized exercise prescriptions. If this video helped you or your family members with diabetes, please subscribe, like, and turn on notifications for more accurate and useful diabetes management information.